Good evening, everyone. Matt here, and today we're going to be talking about some of the health risks associated with obesity. So, there are multiple conditions that can be attributed to obesity, such as coronary heart disease, type 2 diabetes, high blood pressure, high cholesterol, digestive and liver problems, sleep apnea, cancers, and complications from surgery. Your body mass index has a relationship to type 2 diabetes and insulin resistance because the amount of non-esterified fatty acids, glycerol, hormones, cytokines, pro-inflammatory markers, and other substances involved in insulin resistance are increased. And your beta islet cells in the pancreas become impaired, causing reduced control of your blood glucose levels. With obesity, the increase of fatty tissue increases the pressure that's exerted on the inner walls of the blood vessels, making the heart have to work harder to circulate blood throughout the body, leading to high blood pressure. So there are many factors that contribute to high blood pressure, such as family history and stress levels, but weight is a modifiable factor, and weight loss can lead to a decrease in your blood pressure. High blood pressure damages the blood vessels and can lead to heart failure because of the increased workload, aneurysm because of the weakened walls in the blood vessels, same thing with stroke, and damage to the kidneys and eyes because of the microscopic blood vessels in those organs become damaged over time. This also can lead to sexual dysfunction because of the damage to the blood vessels that provide blood flow to those organs and limited blood flow. So some people have a genetic predisposition to high cholesterol levels, but your intake and your exercise play important roles in controlling this. High cholesterol levels will increase the likelihood of developing a heart attack or stroke because of a blockage in these blood vessels which supply blood to these organ systems, oxygen, and nutrients. Both digestive problems and liver disease can be caused by obesity, such as gastroesophageal reflux disease, erosive esophagitis, Barrett's esophagus, polyps, cirrhosis, gallstones, pancreatitis, and pancreatic cancer. And this can all be attributed to obesity. So the obese population is more likely to develop obstructive sleep apnea, which is a potentially serious disorder. This happens when breathing repeatedly stops and starts back up during the sleep cycle. It can be categorized by very loud snoring, gasping for air during sleep, and waking up regularly feeling exhausted and having a dry mouth in the morning. This happens because during your sleep, the throat and the tongue muscles are relaxed, and the soft tissue blocks the airway. And having a thick neck circumference can contribute to this problem as well. It's believed that certain cancers, such as colorectal, breast cancer, pancreatic cancer, and renal cancers, can all be linked to obesity due to the increase of your visceral fat that surrounds these organ systems, which causes inflammation. And this irritation over time is thought to believe, or is believed to cause cancer. So the obese are also at an increased risk of complications during surgery. And this makes it a little bit more difficult to intubate and sedate a patient. And difficulty intubating a patient can compromise the airway and lead to poor management. Management of the airway leading to death in some cases as well. Thank you very much for your time. Have a great day.